Hawa Abu was born and raised in Nigeria, where she attended medical school at the Premier University of Ibadan and graduated in 2010. She underwent her one-year internship and worked for 3 years as a medical officer with the military and in underserved communities. In 2014, leaving behind her family in Nigeria, she obtained a master's degree of public health at the Johns Hopkins Bloomberg School of Public Health. In 2016, she began doctoral training in clinical and population health and research at the University of Massachusetts Chan Medical School. She served as a postdoctoral research associate in cardiovascular medicine at UMass. She has successfully published over 30 research articles. She is presently a third-year internal medicine resident at Saint Vincent Hospital and looks forward to rejoining the UMass Chan community in her Geriatrics fellowship in July of 2023 and attaining her career goal of being a physician scientist. She blends her career with being a wife and mother of 3 children. Thank you for doing this interview with us. Talk to me about how medicine was practiced or is practiced in Nigeria and what your experience was there.
Thank you for having me on the show. And so to begin, the practice of medicine in Nigeria is quite interesting. So we have a variety of cases that we tend to see, more tropical illnesses, so febrile, malaria, for example, typhoid, more the kind of things you would see in developing countries, I would say, and less of chronic diseases like hypertension, diabetes. But it's interesting, I think we began to have the epidemiologic transition where chronic comorbidities started to creep into the system, at least before I left the country. And managing those kind of cases was a bit tough because of poor access to healthcare in varying ways, either due to physical location or lack of insurance and ability for patients to pay for themselves.
Mm-hmm. And you made a decision to come to this country and further your studies. How was the transition?
I think in summary, I would say it was quite tough and rough, but at the end of the day, it was worth it. Yes, and it was greatly inspired by my dad. He had suggested to me, given my profound interest in research, to come do a master's in public health, and then began my journey. Eventually, now I'm a resident in internal medicine.
Mm-hmm. And were there a lot of technical paperwork and rules and everything that you needed to deal with coming to this country?
Sure, there were lots of paperwork to be filled, and I came in as an F1 student, so that was my immigration status when I first came. And I remained an F1 student for a while because afterwards I had to work as a research assistant. But I'm grateful after being able to publish a number of articles, scientific articles, I could apply for the NIW. So that's the National Interest Waiver that says that my research is of significant contribution to the US, and eventually got my permanent residency status.
Mm-hmm. And with regard to just becoming acclimated to this country, what was your experience, both in your community where you lived as well as professionally with your colleagues in medicine?
That's interesting. I would say there was a culture shock for me. I know most people say that, but I say it and I really mean it because, first of all, I think professionally, just addressing my teachers and professors in school, what I realized, for example, during my doctoral program was most of my teachers would say, you need to address me by my first name. And so specifically, Rob Goldberg would say, you have to call me Rob. And I say, no, Dr. Goldberg. And this was at UMass. And he insisted and say, if you don't call me Rob, then I wouldn't be your mentor anymore. It was just a very funny experience. But it was wonderful because, compared to where I'm from, it was sort of like a stricter relationship between you and your mentor. But this was a lot nicer, more relaxed. And I feel like you could express yourself and be who you were made to be. And then I'd say personally, sort of the food, the culture, the weather, very much different from the tropics.
Mm-hmm. And with regard to culture, what sort of differences did you encounter and how did you deal with them?
So with regards to culture, I think one of the things I found interesting was just, so in bringing up kids, I think it's quite different because I do have kids of my own. One of the things that I learned very quickly is children here become very independent at a younger age compared to in Nigeria, where I'm from. Children tend to, rely more on their parents, tend to rely on them for making, especially life decisions, even when it comes to who I get married to, where I want to spend the rest of my life. Just as I said, my dad influenced my moving over here to the US. So parents tend to have a lot more control, but I'm learning to realize that, it's sort of like teamwork when you work with your kids over here.
Okay. And with regard to the training here, how does the training here compare to your training in Nigeria? You essentially did an internship in Nigeria and you went through medical school. You're doing a residency here in addition to all of your other work.
Yeah, so I would say one of the things that I appreciate here is the fact that there's a lot of continuity here in terms of patient care. I would say some of the things that we struggled with in Nigeria was there were times that there was interruption in your education. And for many reasons, sometimes political reasons and stuff, but you would have people staying on longer than they should have. But over here in the US, it was nice that once you got in, you knew that you'll be there for 3 years, and it ends up being 3 years, if you're going into a 3-year program. The other thing I would say is just culturally, Nigeria has a paternalistic approach in patient care where the doctor decides on the care the patient gets. But over here in the US, I'm, getting to learn and enjoying the shared decision-making approach in patient care, where the doctor isn't sitting and making decisions, but sort of interacting with their patients and coming together as a team, because I feel like this also ensures and encourages adherence, because rather than tell the patients what to do, you get to make them, decide on what they think is best for them and do it together as a team.
Mm-hmm. And with regard to the conditions you're seeing, what sort of conditions are you seeing? And have you had much exposure to immigrants or refugees in your clinical practice? And what sort of conditions did you encounter if you did?
All right. So the kind of conditions that we tend to see in internal medicine is a variety of cases. So just going from head to toe, so a lot of stroke cases. And then for patients coming in with pneumonia, with COVID, obviously, that was different. We didn't have that back in Nigeria when I was there. This only started in between 2019 and 2020. And a lot of cases of bronchitis, COPD, which, in comparison to Nigeria, tends to be less just because we don't have as much smoking. The prevalence is less. So there's more here, I would say, like COPD, asthma. And then GI-wise, Crohn's disease, more common here, obviously, ulcerative colitis, celiac disease, and then just generally nephrology. I've seen quite a number of patients with end-stage renal disease requiring dialysis, and that was something that we struggled with in Nigeria just because, most of the facilities didn't have either dialysis machines or the ability to perform transplants. So, and that's something that I've learned quite a lot by interacting with the specialists in these areas. Mm-hmm. And then, yes, I've seen a number of migrants who have come to the hospital. And they tend to have sort of the kinds of conditions that are common here. So hypertension, diabetes. Some of them eventually develop maybe chronic kidney disease in different stages at some point. And most of the immigrants that have had the opportunity to manage have been people who either have been here for a number of years, so not necessarily younger generation, I would say.
Mm-hmm. Excellent. And what are your plans going forward? What lies in the future for you?
That's a good question. Yeah, so I'm excited that I'm going to be joining the geriatrics program at UMass. And so that's going to be in July 2023. And mm-hmm. Subsequently, I'm thinking about going into faculty, becoming a physician scientist. So mm-hmm. combining my clinical practice with research, because my goal ultimately is to be able to improve patient care. And by doing this, I want to be able to, answer questions through research and get to translate them into the bedside.
Okay. All right. Is there anything further you'd like to say about your experience as an immigrant yourself, or with regard to the system you're working in?
I think one word that I have is gratitude. I'm just grateful to be here, grateful to have my family here, and grateful to have my colleagues, my peers, my teachers, especially at Saint Vincent Hospital, where I'm currently a resident, a third-year resident in internal medicine, and at UMass as well, because most of these people that I have interacted with are as good as family, just not just colleagues at work, but people that I've lived with and come to enjoy spending most of my time with. And I'm also, grateful and thankful for my family, my parents, my husband, my kids, and just thankful to be alive and grateful to God as well.
Thank you for taking the time to speak with us today.